So when we first met, the thing that struck me was you talked about empathy in design, empathy in the design of digital tools, and how that could really extend the empathy of the creator and empathy of the organization to those patients. Can you give our listeners a little background on that concept?
Yeah, and I'll share a story of how I learned the value here. Um, Empathy in design is a simple concept. Put yourself in the shoes of the user, right? And try to experience their day, their life, their concerns through their eyes, and try to meet them with a solution that's going to be really assistive, helpful, and productive for them. And moving to Silicon Valley is a bizarre experience, right? It's a crazy world here. And I was out on a fundraising circuit for our Series A financings. This is years ago. And I had the opportunity to pitch to Greylock Ventures, which is a big venture capital group here in the Valley. And one of their partners is a guy named Josh Ellman. And Josh was the principal product designer at Twitter, Facebook, and LinkedIn in the sort of the moment when those companies went like this. Clearly he's a special guy. He probably doesn't remember our conversation. I did a demonstration for him of HealthLoop, and at that moment in time, HealthLoop was really about how do we identify the patients that need help. And it was a really clinical mindset. It would be like, Bill, what's your weight today? Bill, did you take your meds today? Do you have any chest pain today? All about getting information from me, right? As a doctor. And he stood back and he said, Todd, the problem with your software is it has no soul. I said, okay, what does that mean? And he says, when we designed LinkedIn or we designed Facebook, every single time a user interacted with a screen, we tried to make sure that there was a tone, in a voice, in a familiarity, and we treat our product as if it's a thoughtful, compassionate person. So I reflected on that and said, HealthLoop isn't a software. HealthLoop is like the best nurse you've ever had, and she's compassionate and she's thoughtful and she knows that you're in pain and she knows that you're scared and she knows that you have questions. And we really flipped in our mind what it meant to be a user of this technology, and started to invest in a content team of physicians and nurses, and we call them empathologists, right, to script these experiences that acknowledge what a patient is going through and put it through a tone and a voice that